one stretch of the imagination. And I don't think anyone, whether you are someone who's hugely in favour of lockdown being the way forward, or someone who actually thinks it's a completely barking mad idea, whichever way you stand, I don't think there was ever any indication that it was going to be going on for this long. And as I said in the last part, it's a real, I think, indictment of Boris's leadership. I'm not going to go in with him too much tonight. I have a feeling Kate Stewart will be doing it for me quite. I think she's going to be quite competent at doing that for me. She's the owner of the Sandon complex. We'll talk to her in just a moment. But I think it's a real indictment of his leadership, the fact that obviously he just wants to be liked by everyone and wants to be optimistic all the time and wants everyone to like him and think that he's so brilliant. So, of course, he comes on the television for the last 12 months telling us it's all going to be brilliant. It's all going to be fine, just a little bit longer. And then it'll all be open and everything will be great and it'll all be wonderful. And, of course, turns out that that's not the case. So I think that that's been a problem. And I think that that is testing everyone's patience to their limit. Not least the entrepreneur and owner of the Sandon complex, Kate Stewart, who joins me live via video link. Hi there, Kate.
Hi, darling.
Nice to have your company again. We're going to bring in Bharat Pankhania, by the way, the senior clinical lecturer at the University of Exeter Medical School. We'll do that in a few minutes because I wanted to start with you, Kate, because, of course, you're an entrepreneur. You're the owner of the Sandon complex. You've got an eye-watering amount of money tied up in that complex of pubs and bars, which is beside Anfield, of course, the stadium in Liverpool. I'm right on that, aren't I?
You are, yeah.
Oh gosh, it must be like listening to Talk Sport. And that's that's where my football knowledge ends, Kate. But quite seriously, you were pretty much hanging by a thread last time we spoke because of all the money you've got tied up, the fact you've got nothing coming in whatsoever. You were talking last time when we spoke about remortgaging to try and get some money out. You were saying that the Chancellor's money that was offered to you is pretty much pointless. Firstly, what was your reaction when you first heard that now it's looking like to get things back to some sense of normality, still with social distancing, July?
I think the key that you've just made is that, it was a big shebang and the grand finale is we get to July, you have normality with social distance, and that's not normality. Not all venues can open up with social distance, and some venues haven't got the capability to do that. So that is not normality for me. It's not normal.
So what does that mean for because what it comes down to at the end of the day, Kate, is the bottom line. And if you have to reopen in July with social distancing, can you put a sort of percentage figure on how much less you'll end up with from a normal week or month of trading?
Yeah, a percentage figure less. I will be 100% less, Christo, because I can't make a penny while people are not in that ground. They've made an announcement about tennis and golf. What about the football? When are people allowed back in the ground? When are we going to have normality? And here's the thing that I will guarantee you will come. So right now we're like, okay, again, July, everyone will go, okay, we'll last till July. We'll get to July. Then we'll get hit with then. We'll probably get let out for August. And then it'll be, oh, here's the winter. Let's go back to lockdown. It's spreading again.
I mean, yeah, I think you're right. I do think that you're right. Though, in fairness, I mean, it would be a fair comment to say that you're right based on what we've heard thus far. However, what we haven't had before is the vaccine. And of course, we are doing credit to the government. I'm loath to give them credit on most things, but credit to the government. The vaccine rollout has been pretty impressive. We've been doing quite well with that. So that is something that might be the saving grace come September. Have you any faith in that happening?
That's all I've heard. The vaccine is going to be the salvation of the world. We're all going to be free once the vaccine comes. The vaccine's here. We're not free. We're not. The same social distancing still in July. So what's going on? So say
that they open Anfield in a socially distanced way so that therefore there are fewer fans going in. Maybe they've got a couple of seats in between each one, but they are having people going in. And then you're allowed to have people in the Sandon complex. Again, socially distancing, rule of 6, all that kind of stuff. I mean, is that going to be enough to keep you ticking over?
No. Absolutely categorically not. I can tell you now that will not keep me going. It's not worth me opening. The Stanton complex is a place where people come. They all come into the bars together. It's a standing pub. We don't have any seating, Christo. So they all come in, they all sing ole, 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 all the songs and everything else. The atmosphere is absolutely electric. They go to the match, they watch the game, they come back, win, lose or draw. That's what it is. It's not, we cannot implement social distancing. It's impossible to do.
What do you think of the government at the moment?
I can't stand Boris anyway. I'm you know that anyway. I'm not a fan.
Yeah.
But these are the same people who were saying not so long ago, Boris, you know, we're not going to give kids free school meals. I have actually stood in Liverpool and watched people having to queue up for food banks. That's how bad it is. That's how much of a bad situation we're in. It's not just hospitality. It's just everyone. Everyone is in dire straits, and that government are not doing anything near what they should be to help us. They're not giving me faith. They're not giving me a roadmap. They're giving me nothing yet again. July, social distancing. It's just a big cop out, isn't it? The terms and conditions apply, and when you read the terms and conditions, mate, we are snookers again.
So what do you need? I mean, if the government again was listening, what is it that you actually need from them that you're not getting?
I want normality. I want a normal life. I suffer from depression anyway, so this has affected me. This lockdown has nearly wiped me out, this one, because it's like, well, what's the point? What is the point? I've got no go in me. I'm usually up, full of enthusiasm, can't wait to get out of bed, can't wait to start my day. I feel like there's nothing to get up for. What is there to get up for? You can't go out. How many walks I've been for? Oh my God, I could be an Olympic walker right now. Well, apart from going for walks, what is there to do? Nothing. We're sitting here, everything's on Skype, there's no social interaction. I like being social. I like being around people. I like going out for meals. I've got nothing.
But also from the point of view that you're obviously, you know, you've still got bills to pay, you've got a mortgage to pay on the complex in which you own. How close are you to the edge? How close are you, and how much is it keeping you awake at night that you might lose it all?
The thing is, I mean, I'm sitting here now and I have had to do predictions for 3 months, for 6 months, for 9 months, because I can't predict when we're going to be open. If I had a clear roadmap, and this is what the roadmap is supposed to be for, so we can all plan and we can all say, okay, well, we're going to be here in July, we're going to be there. I have got no faith in the government. I've got no faith in Boris. This is what I feel like right now. I feel like we'll all go bust in the hospitality sector. Good old Tim Martin, Boris's Bessie, will end up coming in and buying the whole thing and monopolising the sector, because they are the only ones who will survive this. The ones who've got the big money backing are the only ones who can come out of this and sit and go put their heads on a pillar of a night and think, yeah, I can go to sleep because I know I've got enough money in the bank. Because independents can't. We can't do it.
Well, let me bring in Dr. Bharat Pankhania. He's a senior clinical lecturer at the University of Exeter Medical School. He's got over 20 years experience in communicable disease control and infectious disease management. Good evening, Dr. Bharat. How are you?
Good evening, Kate. Good evening, Christo. Lovely to see you both.
So you just heard what Kate's got to say there. Obviously, you know, really impassioned, really, I say this with love, a woman on the edge, frankly, when it comes to her business and her livelihood and everything involved in trying to hold it together on a day-to-day basis. Can you tell us about what's happening here with the science and why it would have to be July that we're looking at when it comes to pubs and bars, and whether that is realistic that even July is going to happen?
Yeah, Christo, so we've been led astray by dates all the time, and dates equals a lot of pain and disappointments, because when somebody tells you, like I tell my little children, tomorrow the internet will be better in the house, and I don't deliver, my son comes and tells me it's not good enough, Dad. And similarly, what we need to do here is follow the data. And the data equals when the case numbers have come down, when the hospitals are in a better position, and when we are managing our test and trace and isolate systems better than we've ever done. And finally, the vaccine coverage is significant in the right age groups. We say all those things have been lined up, and now we feel more comfortable, more safer to drop those infection control guards. And I feel very sorry. I feel very sorry for Kate and people like Kate and small enterprises, independent enterprises, because they need to be financially supported in the meantime, because otherwise, as Kate Stewart has been saying, they will go under, and it's not fair upon them. They need our support.
We would. Okay, what would you like to say to respond to that?
You know what I'd like to ask you, Doctor? Okay, data, we can't lie with data. Data's there and it's factual. Okay, I totally get that. We've closed hospitality. We've put everyone on lockdown. Why didn't we close the borders? Why didn't the government close the borders down and say, okay, we're keeping our country safe? He had everyone flying in and out the country. People are coming through the airport from hotspots, South Africa.
I mean, it's a very good question. A lot of people who've been suffering this must be looking at this thinking, well, hang on, what's going on? Where do you stand on that, Doctor?
Yeah, sure. Kate, I agree with you. And we've missed many tricks on this business. So I remember very earlier on in about February, March last year, advocating that whilst we are scrutinizing Wuhan and countries near China where the epicenter was, we are not focusing on people coming in from other countries who may also be infected. And that's how the infection was introduced into the UK via skiers returning from northern Italy. We didn't close our borders because we didn't, and we should have. And to be honest, so late in the pandemic, we are symbolically putting in some measure, some type of measure with border closures. I'm not sure it will be as effective as it should be.
And obviously we've been given, Doctor, last February, March, we were told it was a temporary lockdown. We were told in summer that things could relax somewhat, and we encourage people to go then and congregate by eating out to help out. Then September sort of comes and schools go back and things go back up. And things are looking a bit grim. By the time Christmas comes, we're told that we're back in lockdown again, but Christmas can happen. Then Christmas actually can't happen, but it's okay because we'll review it in January. January comes along, we're told it's going to be February. February comes along, we're told it's going to be February the 22nd. We're now told that it might still go on until July. I mean, was this all known, do you think? If you're saying that this is all led by data, as Kate also pointed out to you, do you think that the government has probably already all along known that it wasn't going to be until at the very least July, but because we have a prime minister that is economical with the truth, shall we say, if I'm being harsh, some might just say a little bit too much of an optimist. Is that been the issue here, or is it genuinely such a changing situation that no one could have predicted that it would be as long as July?
Christo, I would like to say, whilst we can never predict 100% all the time and get it right, a lot of it was known and we know about the patterns. Unfortunately, we've had a series of false dawns because we've overpromised, and we've overpromised when we should not have promised. And those are the stresses that we've introduced into the system by overpromising that it will be all right by summer, it will be all right by Christmas, we're going to have a 5-day Christmas, and then we had 1 day of schools and then they were suddenly shut. All of those could be seen, were seen, I could see it, my colleagues could see it, but we've had this thing of we need to keep people happy, and then the decisions are only taken when they're almost forced upon you to take them, which is such a pity.
So what should, if Kate wanted to be up, I'll let you come in, Kate, in just a sec, but just one more question, because if Kate wanted to be up and running by now, what should have been done last year? Because I can't help but think that what we should have been doing, and maybe hindsight's a wonderful thing, but again, I say this all the time, I'm not paid the big bucks to know it at the time. I'm paid to have hindsight. But what it sounds like we should have done was actually from March last year, done what Kate just suggested, close the borders, go absolutely really harsh on it for maybe 6 months, 7 months. And then by January, we could have actually been opening things back up. I mean, is that a fair assessment? What should we have done to have had everything back up and running by now?
Yes, Christo, you are right. We should have done all necessary measures, hard and fast and extensive and strictly enforced. And if we had done that in the first instance and not sort of given way and not been half-hearted about things, we would be, as United Kingdom, in a much better place. We would have had less than our 120,000 deaths. We would have economies not trashed. We would not have had our third lockdown. So earlier on, had we acted as we should have acted, and it is not a case of we didn't know the science, therefore we didn't act. It was just a reluctance to act, and that's why we are in the position we are in.
I mean, Kate, what do you say to all of that? Did Boris buckle under pressure? Would you now, with hindsight, have been happier to have perhaps had harsher restrictions earlier on that could have then given you something more solid now?
No, I would have been quite happy. Borders closed, solid restrictions, get this over and done with, get the virus out the way and come back. But Doctor, you've looked at the data right the way through this pandemic. Are you frustrated with the government, the way they've acted? They've had the clear data and they have then they've had to act on it. Do you feel frustration?
I do. I very much feel frustration, and I also feel very sad because 120,000 plus people have died, and we in the United Kingdom can do better because we are a very advanced economy. I have spent my life teaching and training and practicing for such what you would call pandemics and emergencies. So we are well practiced. Considering we are well practiced, we did not do what we practice. And that hurts. That really hurts, because you say, what is my use if all these years I have been training people, and when the day came, we didn't do what we trained to do?
So what was the chain of events that we should have done then? So close the borders being one of them. What else should we have done in an ideal response that could have meant Kate would open eventually and our deaths would have remained low enough that we could have looked at this as not a success, but as much of a success as it could have been?
Okay, so what I want to do is put it in very, very simple terms, because I want all our viewers, listeners to understand, which is this. If you tackle a small outbreak and subdue it immediately, you don't allow it to spread. Once it has spread, you lose control. You're not in control. You're always catching up. So what would I done? What we should have done, what we advised we should do, is a serious, harsh, strictly enforced, extensive, early lockdown. And second point, you enable British industries to set up plant, to set up the testing mechanisms. So you set up the laboratories to develop the tests, to send the tests out, to do the testing early. Third point, we allow the contact tracing to be done by local experts, because I've done contact tracing for most of my career. And when we do it locally in conjunction with local partners, we achieve a lot more at a lot less cost. One more thing, we could have allowed our own industries to change direction and make PPE for us, rather than go around looking at China and Turkey to buy hopeless PPE that didn't work and cost us a lot of money. And finally, have a look at this. The National Health Service was enabled and asked to lead on delivering the vaccines. They have led on vaccine delivery and achieved a great result at minimum cost. We always knew they could deliver it. That is what I've always been saying. Allow the local people to lead, we would be in a better place.
So, Kate, when you hear about that catalogue of missed opportunities, the catalogue of errors, the billions spent on a testing and tracing system which still isn't up to scratch, you'll still wait days and days for a test result, and it won't even be, or in some cases, a particularly accurate one. Again, you are at the coalface of this. You are the person, and your business, your employees, that are at the brunt of these decisions being made badly. What's your reaction? How do you feel when you hear that?
Do you know, if it was me who had done all this, I would be put before the court of law, and I would probably be sent to jail for life. For life. That is how bad it is, what's being done. It's an absolute atrocious mess. They have led us to disaster. We're nigh on disaster. We are going to be in a major depression for many years to come. I foresee my grandkids having to pay this back. I really, really do. But you know what? Boris will probably resign, move on to be a big, well-paid job and everything else, and it'll all get brushed onto the table as per normal. The death rate in alcoholism has gone up by 20% since alcohol-related deaths have gone up 20% since pubs closed. And that's a fact. We at least had it where measures are properly. It was at a set time. People had socialised, go home. They've just left it to rack and ruin. It's an absolute joke shop. I would be ashamed if I had anything to do with the government right now. Plus the fact, Doctor, you're using all of your expertise to look at all of this data and analyse it and come up with it. The own ministers and the government are not listening to it. You see them driving around, you see them breaking the rules. What are the people meant to think when they're watching the leaders of this country ignoring the data, ignoring the science? That's why people haven't really took it serious. It's like, well, if you don't, why should we? Shambles, aren't stand
I mean, what do you say to that? Because that must be an awful frustration for you. You know, you're an honourable man, Dr. Pankhania, and as you were saying at the start, you know, you've trained for this all your life. You're now with someone and who is absolutely on the receiving end of the government not taking advice from people like you. How do you feel hearing that?
I feel it's a tragedy because I'm a citizen of the United Kingdom and I feel the pain of everyone. And there is a lot of pain. I feel the pain of all those people who've died in nursing homes, all those people who should not have died in nursing homes, all those people who died alone. These are all failings. We never planned for people to die alone. It is a catastrophic failure and it hurts. It really hurts that, you know, I'm not just a single voice. There are many friends and colleagues who've all been saying the same thing, but our leaders took certain decisions and they kept to their certain decisions and there is nothing we can do. That frustration of there is nothing we can do also hurts.
So what next? What do you think needs to happen next so that Kate can be confident that at some point, be it July or whatever it might be, if you were advising the government at the moment, what should they be looking at? I mean, it does look like now, perhaps it's sunk in at last, if you are to believe what you read with what Boris is planning. And as I said, he has got a little bit of a problem with the truth, but it does look like they are going to be extremely data focused in order to make their next moves so that we don't end up in lockdown number 4. From what you've read, does it seem like they're on the right track?
Yes, we are on the right track, but we are on the right track because of the measures that are in place. So what would I advise? I would advise first and foremost, please do not listen to your pressure groups, your MPs who just want business open at any cost, because business open at any cost equals costs lives. Look at the evidence. So the evidence is when you have brought down the case numbers, 1, when the hospitals are in a better position, meaning they've got capacity and they're not going to be overwhelmed. Number 3, when your immunizations has been done to such a large number of people that the circulating virus plus the number of people immunized is substantial, you can then take the foot off the restrictions and start allowing people to socialize, go out their business, have holidays, etc. But it has to be measured and driven by the evidence rather than pressure to just open at any cost.
And Kate, does that give you any kind of reassurance?
It does, Doctor. In your opinion, hands on your heart now, do you think that there will ever be normality, life as we knew it pre-COVID?
Hand on my heart, Kate, I think we are very far away from normality because normality equals local, national and international. And we are very far away from international normality. And when we are only well when everyone else is also well. So we are a long way away. Some good things have come from the pandemic, which is we can teach from home and we can do conferences from home and that sort of thing. And some of us will become habituated to wearing masks and things. Those are all good measures. Are we going to be back to normal in the short period? No. And it is better to say no. There are just too many uncertainties. And one more last thing, if I may add, this is very, very important. whilst you are busy immunizing the people of the United Kingdom, if you do not contribute and immunize other people in other parts of the world, the poorer parts, then the virus will mutate and you will have new variants. And when new variants emerge, they could come back to undo the work of your vaccines. So it is in our self-interest to be kind and generous and enable other people in other poorer parts of the world to also be immunized at the same time.
Listen, we've got to leave it there. Dr. Bharat Pankhania, really great to hear your views. Well, I say great. I don't think anyone's going to be thrilled at what you've just said. Kate, we wish you love and luck. Thank you for taking the time to talk to us as well. I don't know if that's going to be much consolation what she's heard. What do you make of what you've just heard?